Hi everybody, so today we're going to be talking about the anterior pituitary gland, and I've already done a video on the posterior pituitary gland, and if you're interested in the posterior pituitary gland, head over to that video. This one's going to be, like I said, the anterior pituitary gland. So we're going to get started, and the first thing we're going to do is look at some differences between the anterior and posterior pituitary gland. So because this is anterior, it's anterior to the posterior pituitary gland. So there's the first difference, right? But some other major differences is if you watch the video on the posterior pituitary gland, you saw that when we have the posterior pituitary gland and the infundibulum, that's called the neural hypothesis. The anterior pituitary gland is known as the Adeno Hypothesis. The other thing is, on the posterior pituitary gland, we said that was made up of neural tissue, basically called pituocytes. This is going to be made up of glandular tissue. Okay, and because it's made up of glandular tissue, it is going to produce hormones. If you recall, when we talked about the posterior pituitary gland, we said it basically just stores hormones. We also said the posterior pituitary gland stored 2 hormones. This is going to produce about 6 hormones. Okay, some books will say 7, but we'll go into that a little bit, okay? So there's the glandular tissue that produces this. The other thing we said is that in the posterior pituitary, it communicates with the hypothalamus to a tract. A tract is a bundle of nerves or nerve axons, and in this case, it's called the hypothalamic hypophyseal tract. Well, this is going to have a vascular connection. It's going to have a vascular connection, and that vascular connection is going to be through something called the hypophyseal portal system, which we'll talk about in just a minute, okay? So there's some differences right there. This is also going to be larger than the posterior pituitary. So let's go ahead and take a look. I'm just going to move my camera over just a little bit to right about there. Okay, and the first thing we're going to do is we're going to take a look. Now, what I've done is I've drawn over here, my posterior pituitary gland is going to be right here. Now, I have this drawn really small. Like I said, the anterior pituitary is larger. But the size difference is not this big. So there's my posterior pituitary gland. Okay, all of this is my anterior pituitary. And again, this is not to scale. All right, I'm just drawing this a lot larger because I'm going to be writing a lot in here. Okay, so there's my posterior pituitary, and here's going to be my anterior pituitary. So let's talk about some things on here. If I were to look at a brain from the side, this would be my cerebrum, the big part of the brain, right? That's my cerebrum. This would be my cerebellum. The cerebellum hangs like a bell off the back of the brain. This is going to be my brainstem, my pons. And then I'm going to have something that I call the hypothalamus is going to be right here. So there's my hypothalamus, right? And then if you recall, the thalamus would basically be up in this region here. Maybe have the epithalamus in there too, but that's for a different video. So here's what's going to happen is in the hypothalamus, we are going to have an eminence, or it's going to basically come together and curve down a little bit like this. It's going to look almost something like this, okay? So I'm going to draw that right in here. And this is going to be called the median eminence. Okay, that's my median eminence, okay? So this would be that right here. What I've done on here is I basically drawn it basically in this area right in here. But you can see I have a big opening there, but just to give you an idea, this is about where my median eminence would be. So let's go ahead and write that. This is the median eminence. Okay, right there. And then we, of course, would be this whole area that's in here. Now the median eminence is where my hypothalamus is going to release either stimulating or inhibiting hormones into a vascular system called the hypophyseal portal system, which I've already mentioned. And then that's going to take those down into my anterior pituitary gland. So let's just fix my pituitary gland real fast, okay? If you recall, we have a stalk that's going to attach this up basically to the hypothalamus. We're going to call this the infundibulum. Okay, so there's my infundibulum right there. And then what we're going to have is we are going to have the anterior pituitary, which is this part here. Now let's talk about the blood supply that goes to my pituitary gland. If you look right here, we have an artery. We're going to call this our internal carotid artery. Okay, that's my internal carotid artery right there. All right, and then what's going to happen is you actually have a trunk that comes off of this. I'm not going to go into it right now, but you have a trunk called the meningohypophyseal trunk, and the meningohypophyseal trunk is basically going to bifurcate into the superior hypophyseal artery, which is going to supply the anterior pituitary gland, and the inferior hypophyseal artery, which is going to supply my posterior pituitary gland. So we're just going to look right now. This is going to be my superior hypophyseal artery right here. Now it's going to come into the median eminence, and then this is going to be a capillary bed right here, okay? A capillary plexus that's right here. So the reason I have the round circles is imagine these are just capillaries. These are a bunch of capillaries that are in the area. So the first one here, we are going to call this our primary capillary plexus. Okay, so that's our primary capillary plexus. Oh, not right there, but up in here, which is all of these blood vessels up in here, all these capillaries up in here. Then what's going to happen is this is going to drain into a vein. Now this is you actually have short and long veins. They're called portal veins or hypophyseal portal veins. I'm just going to put portal veins for right now, but we're going to have our portal veins. Right, there's our portal vein. And then down here, we're going to have what we call the secondary capillary plexus. So this is going to be our secondary capillary plexus. Now, what's unusual about this, and imagine these are all capillaries. I just have them drawn like this because I'm going to be using these in just a minute. What's so odd about this is normally we go from an artery to capillaries to veins. Right? If you want to include the arterioles and the venules, you can. But normally we go from the arteries to the capillaries to the veins, and then the veins take the blood back to the heart. This is unusual because we go from an artery to a capillary plexus, or we go to capillaries, then we go to a vein, then we go back to capillaries, which is not that common, right? The reason it does this is so hormones that are coming from the hypothalamus don't get diluted. All right, so now that's that, and this is going to be called our, I'm going to erase this. This is going to be called our hypophyseal, let's put it up here, hypophyseal portal system. Okay, so this is all our hypophyseal portal system. This all in here, okay? So now let's go on and take a look at this. Here's what's going to happen. We're going to start with this right here, and we are going to call this right here the paraventricular nucleus. Now, if you recall when we did the posterior pituitary gland, we also had the paraventricular nucleus, right? We said it supplied oxytocin to the posterior pituitary gland. This is going to do that. It's going to supply oxytocin to the posterior pituitary. Let me just write this back in here. Right? So it's going to supply it to the posterior pituitary, but it's also going to supply some hormones here. And the first one it's going to supply is what we call CRH, corticotropin releasing hormone. Corticotropin releasing hormone. Okay, corticotropin releasing hormone. So corticotropin releasing hormone is going to come out of our paraventricular nucleus, enter into the primary capillary plexus, go through the portal veins, and then into this secondary plexus right here. And then what it's going to do is it's going to come down to a cell called a corticotrope. Okay, that's the name of the cell. It's called a corticotrope. And then what's going to happen is this is going to cause the corticotrope to be stimulated, and the corticotrope is going to release a hormone called ACTH, adrenocortical hormone, adrenocorticotropic hormone, adrenocorticotropic hormone. So now what's going to happen is our adrenocorticotropic hormone is going to go through the blood, and it's going to go down to the adrenal cortex. Okay, so it's going to go to the adrenal cortex, and then what's going to happen is from there it will cause the release of cortisol. Okay, and normally that's going to be released in times of stress. Let me just move this over just a little bit. Go just like that. All right. So it's going to produce cortisol. Now, just to give you an idea, if you recall, you have your kidneys, and then on top of your kidneys, you are going to have a gland, and we're going to call this gland our adrenal gland, right? And then if you recall, the inside portion of the adrenal gland, we'll use blue. The inside portion of the adrenal gland was called the medulla, right? But the outside portion out here is called the cortex. So this is going to come down, it's going to work on the cortex on the adrenal gland, and it's going to work in times of stress and things such as that. This can also be stimulated if someone has a fever, if they're hypoglycemic, and like we said, when they're stressed. So that's that one. Let's go on to the next one. So now, the other thing that's going to be released out of here is we have something called TRH. TRH stands for thyrotropin releasing hormone. It's thyrotropin releasing hormone. This is going to be released by the paraventricular nucleus. It's going to come down into here, it's going to go into here, and then what's going to happen is it's going to get to here, and it's going to go to a cell called a thyrotrope. It's going to go to a cell called a thyrotrope. And then what the thyrotrope is going to do is it's going to release a hormone that we are going to call TSH. TSH stands for thyroid stimulating hormone. Okay, so obviously what we're going to do now is we're going to stimulate the thyroid. So this is then going to go to the thyroid. And what the thyroid is going to do is it's going to release its hormones, T3 and T4. We'll talk more about those in another video. And remember, this is going to play a role in metabolism. So when these levels are low, this is released. When these levels get high, this is cut off. It's a negative feedback type thing. So let's go on. And the next thing we're going to do is let's look at this guy right here. So this is what we call the preoptic nucleus. And the preoptic nucleus is going to secrete something that we call GnRH, gonadotropin releasing hormone. Gonadotropin releasing hormone. So here's what's going to happen here is I am going to have my gonadotropin releasing hormone come down. It's going to go through the primary capillary plexus into the portal veins, then down into the second capillary plexus, and it's going to go to a cell called a gonadotrope. Okay, it's going to go to a cell called a gonadotrope. And then what's going to happen is once it gets to this gonadotrope, it's going to activate this gonadotrope, and the gonadotrope is now going to release two different hormones. One is going to be called FSH, which is known as follicle stimulating hormone, right? So we're going to have FSH, which is follicle stimulating hormone, and we're going to have LH, which is luteinizing hormone. So what's going to happen now is these two are going to go down to our ovaries and down to the testes. And what they're going to do is they're going to cause the release of those gonadal hormones as well as sperm production and ovulation, right? And then when these levels increase, that's going to go ahead and be shut off. The next one, oh, and by the way, this can also be released by the arcuate nucleus right here. So I'm just going to draw this going like this, but our arcuate nucleus can also release gonadotropic releasing hormone. So now, we have this guy right here. So what do we have with this? This is going to be called our arcuate nucleus, right? That's our arcuate nucleus. Okay, and this is also going to release two different types of hormones. The first one we're going to talk about is something we call GHRH, and GHRH is going to basically be released, and it's going to come down through into the primary capillary plexus, into the portal veins, through the secondary capillary plexus, and it is going to go to a cell called a somatotrope. Right? It's going to go to a cell called the somatotrope. And what the somatotrope is going to do is it's going to produce a hormone which we call growth hormone. I'm going to put GH for growth hormone. And then what the growth hormone is going to do is it basically goes to every tissue in the body, but we're going to be more concerned about bone, muscles, the liver. Okay, it's going to cause protein synthesis, it's going to cause growth, it's going to play a role also in it's going to play a role in metabolism, right? So it's going to be responsible. I'm just going to put growth and metabolism. I'll go through this more in another video. All right, so there's that. Now, there's also another factor that's going to be produced. But when we get too much or when we need to shut this off, you actually have something called the periventricular nucleus. That's the paraventricular nucleus. You have the periventricular nucleus. And the periventricular nucleus is going to release a hormone that we call GIH, which is growth hormone inhibitory hormone. That's going to come down and that would shut that off when you don't need it, right? So now, that's that. Now let's look at one last one, and let's go with, let's go brown, all right? This is going to be called prolactin inhibitory hormone, or it's also known as dopamine. Okay, it's also known as dopamine. So basically what's going to happen is this is going to be released, and this is going to come down into here, and then it's going to come down through here. And before we talk about what that's going to do, let's talk about what's happening here. You have something called a lactotrope. Okay, you have a lactotrope, which is going to be right here. And what the lactotrope is responsible for is producing prolactin. And if you recall, prolactin is responsible for the production of breast milk, right? So now, that's what it does when this prolactin inhibitory hormone is not working. So here's what's going to happen in this case, is when this is released, it gets into the bloodstream and it shuts this off. If you notice, all of these have trope. Trope means to turn on, right? This was turned on, this was turned on, this was turned on, this was turned on. But this one's going to be turned off. When the dopamine or prolactin inhibitory hormone gets to this, this is going to be decreased. And when that's decreased, the breast milk is also going to be decreased too. It's going to work on the mammary glands, right, for the production of breast milk. All right, so that's that. One last thing I forgot to say is that on GHIH, this is also known as somatostatin, right, because it stops GHRH from being released. It stops the release of growth hormone, right? So that's it for the anterior pituitary gland. Thank you so much for watching. If you enjoyed the video, please hit the like and subscribe button, and we will catch you next time. I'm going to move this just back a little bit so you guys can take a good look at what I drew. And thanks for watching.